Good afternoon. My name is Will Alton. Thank you to you all for joining us for this live Wiltshire COVID-19 public update. I'm going to give you a quick introduction about how this will work, and then we'll get on with the session. So before I get started, on the bottom right of the screen, you should see a little box with the letters CC in it. If you wish to see closed captions of speakers' words, then click on the CC button and they should appear after half a minute. The system sometimes takes a little while to get warmed up. If you're having technical problems, I suggest closing Teams on your browser, reopening and clicking on the meeting link again that was sent earlier. Other problems may be down to your home internet connection. If you're having technical problems, it might be you're hearing an echo. It may be that you have this event open in 2 or more windows. I'd close one window and then see if that works. To enable full answers to be prepared, we've asked for questions to be submitted in advance. Thanks to everyone who submitted a question, we received a great response. Obviously, we can't answer all the questions, but they've been grouped into key themes, and we will try to cover as many points as possible during tonight's session. So that's it for me, and I'm going to hand over now to Philip Whitehead.
Hello, and a warm welcome to all of you, and thank you for joining us at today's COVID-19 webinar. This session actually was already planned and booked before the announcements on Saturday, but we're pleased to be here to be able to provide as much information as we're able to do at this stage, although I suspect many of the questions will have changed, at least in people's minds. So in answering the questions, we'll spread it out to pick up the information that's been received since Saturday and over the weekend. I'm pleased to be joined by Kate Blackburn, Director of Public Health for Wiltshire, and Terence Herbert, Chief Executive at Wiltshire Council. Each of us will provide short updates and then hopefully leave plenty of time to answer as many of the questions that have been sent into us from yourselves. And my thanks to you for taking the time to do that. We are very conscious that there's a lot of information out there on COVID-19, a lot of old information, although it's 6-7 months worth. There's been lots of changes, and that can be quite overwhelming at times, particularly when changes are announced at the weekend. People are busy at weekends. Sometimes you don't pick it up straight away, and then you lose the pace of what's happening. Hopefully we can provide you some answers to that and some direction going forward. But please don't forget, if you've anything that we do not address or whatever, just email into Wiltshire Council and we'll respond directly to you. Firstly, I wanted to say a really big thank you. I think the attitude of the Wiltshire residents, the strength, resilience and togetherness that we've shown over the past 8 months has been a real clear shining light in an otherwise quite difficult and dark year. It shows that true communities can respond to anything that happens to them, and it shows that we can work together, support our neighbours, our fellow residents. I know it will continue to be a challenging time, but I'm absolutely confident that will continue to be the case when increased restrictions coming on Thursday. We will still cope, we will still manage, and we'll still go forward as a very coherent county. Just to quickly highlight some of those changes that have happened, just so that people understand. So from Thursday the 5th of November, everyone must stay at home and must leave only for a limited set of reasons, which include for education, for work if you cannot work from home, for exercise and recreation outdoors or with your household. That's your household support bubble or on your own with one person from another household. That person has to be the same person time and time again. For all medical reasons, appointments and to escape injury or harm, and I stress that medical appointments currently made should continue, and as with dentists and other things, and I was told today, vets as well, to shop for food and essentials, and to provide care for vulnerable people or working as a volunteer. Non-essential shops, leisure and entertainment venues will be closed. Click and collect services can continue, and essential shops, including supermarkets, will remain open. Pubs, bars, restaurants must close, except for takeaway and delivery services. The coronavirus job retention scheme, known as the furlough scheme, will now remain open until December, with employers receiving 80% of their current salary for hours not worked, up to a maximum of £2,500. Throughout this time, we at Wiltshire Council have asked you to keep you playing your part, and we thank you for having done that. Ironically, this crisis started in the winter at the start of the year, and we're now just about back in winter now. And therefore, one of the most difficult aspects of it is that it's been a long time. And you start to feel the level of exhaustion, and you become weary, and that in itself becomes stressful. However, if we continue to follow the guidance and continue to do everything as we should do, we will get through this period as quickly as we can, and we will. And the most important thing about it is we will keep each other safe, and that's got to be our aim throughout this. Even when the worst of COVID-19 is eventually over, there will be remnants of it still around on our day-to-day lives. People may have lost relatives, people may have lost friends, and we need to be aware of that. But please be assured this council will be here to support you throughout all of it. That's enough for me for now. I'll now hand over to Kate to provide you with a public health update for Wiltshire.
Thank you, Philip. Hello, everyone. I'm Kate Blackburn, Director of Public Health for Wiltshire. Firstly, I'd like to reiterate Philip's thank yous to you all for your support over the last 8 months. It's been a really challenging and difficult year so far, and there are further tough times ahead. But your efforts so far have helped us to keep numbers of the virus low across our county in comparison to the national picture. And with the new restrictions that have been announced, it is likely that we will start to show a gradual decline in the number of cases and the transmission of the virus nationally. However, as I talk to you today, the number of cases in Wiltshire has been rising rapidly. And so it's really vital that we keep on with our efforts so that we minimise the transmission of the virus and start to bring our infection rates down. And this is going to be even more critical when these new restrictions are lifted and we start to come into contact with more people again. This virus really likes people. So the more contacts you have, the more chances you give the virus to spread to other people. So we have to be really mindful of that. So I'm just going to provide you the latest update on the case numbers in the county, and it's important just to note that these numbers refer to the Wiltshire Council Local Authority area, so these numbers do not include Swindon numbers. So as you can see on the screen, to date we've had a total of 3,256 positive cases of COVID-19 since the start of the pandemic. And that's been with 459 cases reported in the last 7 days. So our 7-day rate of new cases for every 100,000 people in Wiltshire is at 91.8 at the moment. And you can see on the slide for context, the rate of cases, that similar rate across England, is 225.8. So Wiltshire is still less than half the national average, but the figures are going up quickly and they will continue to do so if we don't change our approach. Now, at the end of every Thursday, the council publish the latest case updates that you can see on the screen now. That goes out on our social media feeds and is also on the website. So please keep an eye out for those. Could I have the next slide, please, Will? Thank you. So the chart on this screen shows you for every day since the start of August what the total number of cases in the last 7 days in Wiltshire was at that time. And you can see that the number of new cases remained relatively low and stable throughout August. But since then, we've seen a continued and then a rapid rise in the number of new cases to our latest available data, which shows 459 cases in the last 7 days. Now, you can see on this chart there's a slight dip with the last data point, which can be due to natural fluctuation in disease transmission. We also know we see lower numbers of people going for coronavirus tests at the weekends, which could have contributed to this dip, but it's highly unlikely that that drop will continue. Now, previously we were seeing the numbers of new cases rising in our younger population across the county, but we're now seeing cases rising very quickly across all age groups in the county, and that includes the 60+ age range, where we know there can be a greater risk of severe illness. Now, that's clearly a worrying trajectory, and if that had continued, we would very likely have moved out of the current medium COVID alert level, which we are currently in, into one with greater restrictions, either the high or the very high levels. However, with the announcement from the Prime Minister at the weekend about increased national restrictions being brought in across the country, that has changed things for all of us. Will, could I have the next slide, please? Thank you. So this slide really shows you Wiltshire's 7-day rate of cases, again since August, and Wiltshire is on this chart as the thick red line that you can see. And what we wanted to do was include some of the rates of the local authorities that border onto Wiltshire. So again, you can see what's happening in those areas closest to us. And as you can see in all of those areas, cases have been rising rapidly throughout September and October. Now, I just wanted to highlight on this slide, as I'm sure it's quite obvious, that Bath and North East Somerset and South Gloucestershire have seen a significantly higher rise than the rest of our neighbouring authorities. Now, that's likely linked to university outbreaks. For Wiltshire, what we've seen actually is an even spread of infection across our county. We haven't seen any hotspots within our area where we've seen significantly higher numbers of cases, but what we have seen is that the main source of infection has been with household spread. So when people are meeting each other in households, that's where we've seen the main cause of viral transmission and spread. We have across the county seen cases linked to schools, care homes, businesses, and our local outbreak management plan and the measures that we've got in place with our partners have been really successful in helping to reduce those areas of transmission back out into the community. So that's been a real positive. And just finally, on the numbers, very sadly, in Wiltshire, we've had 370 registered deaths that have included COVID-19 on the death certificate, which and the rate of our mortality in Wiltshire, whilst is lower than the national average, it's still incredibly sad. And despite the new restrictions easing some of the immediate pressure that we may see, we've really got to stay vigilant and continue to do everything we can to ensure the virus doesn't start spreading again when these restrictions are lifted. So please, I know these messages are very well known to you all now, but the only way we'll be able to stem the transmission of this virus across our county is if we continue to follow the guidance. So whenever you go out, please practice good hand hygiene. Wash your hands with soap and water for 20 seconds. It's that which will make the virus no longer infectious and an issue on your skin. So it's really vital. It's such a small thing, but it helps so much in breaking the transmission of the virus. Making sure that you're wearing a face covering in places where you need to. That's for the protection of people around you. That's how we can protect our communities and our vulnerable people. Making sure you're socially distanced from other people. 2 meters is that distance at which you're very unlikely to have the virus spread to you. So really keeping in mind how large 2 meters is. And if you experience any of the COVID symptoms, so an increased temperature, a loss or a change to your sense of taste or smell, and that new or persistent cough, you and everyone in your household must self-isolate straight away and book a test so that you can see whether you do have coronavirus. And you must only leave your house during that time to get a test, and you mustn't leave the household while you're waiting to get your results. That's so very, very important if we're to break the transmission of the virus across our communities. I know it's really inconvenient, and I know it's a real disruption for anyone who has to self-isolate. I know this firsthand, but spreading COVID will likely have far worse consequences for us all. And so I'm asking you really please to follow the guidance and obey the law. I hope that's been helpful to put some context for you around Wiltshire and what we've been seeing locally in our county. I really don't want to be the person who is always all doom and gloom, but it is really important that we understand this situation and how critical it is at the moment, that we mustn't let our guard down. We mustn't start to let complacency creep in. And I am confident that things will get better. I really am, but that requires all of us to continue to play our part. So again, thank you so much for all of your support, and I'll now pass you on to Terence.
Good evening, everyone. I'm Terence Herbert. I'm the Chief Executive of Wiltshire Council, and I hope you found the webinar useful so far. So I wanted to talk to you a little bit about the work that we've done to support our residents and the services that we've provided over the last 8 months, and importantly, what we're going to be doing during this next period of the increased restrictions and beyond. So, as you know, from Thursday, the majority of us are going to need to stay at home as much as possible. And we know that it's already been an incredibly difficult time. It seems like February and last year were about 10 years ago. But it's our job to help to support you all as much as possible to get you through this, and to let you know that we're still going to provide those key services that you rely upon. So during the first lockdown period from March this year, our teams worked around the clock to ensure that vulnerable people and businesses had everything that they needed. That included delivering more than 1,400 food parcels, supporting hundreds of schools. We responded to over 15,000 calls through our Wiltshire Wellbeing Hub, and we issued over 8,000 grants to businesses that totaled almost £100 million. And we made direct contact with 24,000 people who were shielding. Now, although the restrictions starting this week are slightly different, we'll still do whatever it takes to help you as much as possible during this period up to the 2nd of December. And as we expect for some kind of restrictions to be into December and the new year. So as Kate said, we're anticipating to having other increased restrictions brought in at some point, although the announcement from government wasn't wholly expected. We were planning for it, and I think we're well placed, and we're certainly organised enough to respond to what's ahead. Almost 20,000 people in Wiltshire have been identified as what's termed as clinically extremely vulnerable. So it's our priority to make sure that they're okay and have the support they need. Government have provided us with some financial support in order to do that, and we're well placed to make sure that those individuals will receive that support. Throughout the pandemic, we've worked really positively with our colleagues, such as the NHS, the care homes, our schools, the voluntary and charity sector, and not to mention the many community groups who sprang up at the start of the pandemic to help their residents and fellow members of the community. Now, this partnership working is going to be really vital, but it's put us in good stead, particularly as we head into what's going to be quite a difficult month. Leaving the house to volunteer or to provide care to the vulnerable is allowed within new restrictions, and we're pretty sure that our communities will rise to that challenge again. So we've been pleased that most of you have been playing your part and following the guidance so far in Wiltshire, and we're sure that we're going to continue this over the next 4 weeks or so, following the guidance that Kate has just outlined. So our approach in Wiltshire has been to engage with people before taking any enforcement action as a last resort. Action will only be taken if that's absolutely necessary, with the majority of people being asked to stay at home and only to leave to get supplies for education purposes or to go to work if they can't do so from home. This should make the restrictions a little simpler than it was before. So as you can imagine, we're finding out information and further details about what the new restrictions mean at quite short notice, so please bear with us. However, we are still expecting that we will be providing the vast majority of council services. We're responsible for a really wide breadth of services, and we'll ensure that many of those continue, from processing planning applications, collecting waste, maintaining roads, to supporting our vulnerable children and supporting the elderly with their care. As you'd expect, it's really vital that we do this type of work on top of the extra responsibilities that government have passed to us during the pandemic. Our Wiltshire Wellbeing Hub is still available should you need any support, advice or guidance, and you can call the hub on 0300 003 4576, or you can email wellbeinghub@wiltshire.gov.uk, and that's Monday to Friday 9 to 5. Saturday and Sunday 10 till 4. No queries too small. Any questions that you have, we will answer. So please get in touch if you're concerned about anything. We would urge you to keep an eye on our COVID-19 webpage. That's at www.wiltshire.gov.uk, as this is going to have all of the latest advice and guidance, as well as what council services will be affected by the new restrictions. We obviously keep that page updated all the time, and you can go to our Twitter pages as well. So we know it's a very uncertain time, and we know that the new restrictions are going to bring a great deal of worry. But to reiterate, we're here to support you. And as was shown back in March, we're going to go above and beyond what's required of us. So we're going to move on to the Q&A element of the webinar. We've had quite a significant response from our residents to our call to submit questions. So thanks for everyone for sending them in. In order to address as many questions as possible, we've grouped them into themes. And I should point out that, well, as Philip did at the very beginning, we have tried to change our responses or modify the responses as much as possible in line with the new restrictions and the information which we've been getting from government on a daily basis. We've been involved in calls with them all over the weekend and yesterday and today. So it's still a very live picture that we're dealing with. So, Will.
Thanks very much, Terence. So the first question is for you, and it's how will the new national restrictions affect council services and what support is the council providing residents?
Okay, so we haven't received all of the guidance. It has been promised today, and we expect to receive it sometime this evening. Philip and I were in a call with the Secretary of State and other council leaders and chief executives today, and we were advised that it would arrive this evening. But what we do know is that many of our services will continue through the new restrictions. And we want to continue to provide as many of those we can. So you've got that commitment from us. Our leisure centres, however, are going to close temporarily. And we don't know what's going to happen with libraries. We're hopeful that we'll be able to provide some kind of library service, but if the restrictions dictate, then our libraries will have to close too. Good news is that our household recycling centres will remain open. And our registration service will be able to conduct many of their services, but they can't conduct weddings or civil partnerships. I'm really pleased to say that our registration team worked hard over the weekend and yesterday and today, contacting as many people who had their marriages or civil partnerships arranged for during the lockdown, and they were able to bring more than 20 of those forward, so at least there'll be some happy couples before lockdown. We are, as I've said, responsible for a huge breadth of services, and we're going to ensure that as many of those as possible can continue, from processing planning applications to visiting some of our more vulnerable children. That, however, is going to be on top of the additional services that we're providing due to the restrictions, including running the Wiltshire Wellbeing Hub, supporting more than 19,000 people who are clinically extremely vulnerable, and those who are going to find this period really quite challenging with their emotional well-being and their health. So it's going to be a busy time, but we showed earlier in the year that we've got incredibly committed staff. And once again, I'm very confident we're going to be able to rise to the challenge and support you.
Thanks very much, Terence. The next question is for you, Philip, and it is, what do the new national restrictions mean for our local economy, and what support is the council providing businesses and employees?
Yeah, I'll start off by talking about what the new restrictions mean from the 5th of November. And the first of that is that all non-essential retail, including but not limited to clothing, electronics, vehicle showrooms, travel agents, betting shops, auction houses, tailors, car washes, tobacco and vape shops will have to close. Indoor and outdoor leisure centres, that's not just ours, that's everyone's. Private ones as well, and such as bowling alleys, gyms, sports facilities, including swimming pool, golf courses, driving ranges, dance studios, riding centres, soft play facilities, climbing walls, climbing centres, archery, shooting ranges, water and theme parks. Entertainment venues such as theatres, concert halls, cinemas, musics, galleries, casinos, adult gaming centres, arcades, bingo halls, botanical gardens, zoos and other animal attractions also have to close. On a personal level, I totally understand people understanding that hairdressers don't entirely worry me any longer, but personal care facilities such as hair, beauty and nail salons, tattoo parlours, spas, massage parlours, body and skin piercing services, non-medical acupuncture and tanning salons also have to close. The ones that stay open are the termed essential, such as food shops, supermarkets, garden centres and other retailers providing essential goods and services can remain open. Non-essential retail can remain open to enable them to deliver to customers or to run a click and collect. And that's quite interesting aspect of it. So non-essential retail, again, being able to stay open if they're providing a click and collect or a delivery service. So they're not open to the public going in there to shop. Hospitality venues like restaurants, bars and pubs must close, but they too can still provide takeaway and delivery services. However, takeaway of alcohol will not be allowed. Hotels, hostels, other accommodations should only open for those who have to travel for work purposes. So if you run a hotel or a bed and breakfast and the people arriving at your bed and breakfast are doing so for work purposes, you can remain open, but you can't run that for people who are just out to visit. Some venues will be allowed to remain open for specific exempt activities like childcare and support groups. Now, it's worth saying that we're still getting the details in terms of exactly what we'll be doing. But last time our teams gave out or passed through from government £96 million to local government, local businesses. And that was to the small business retail, hospitality, leisure and discretionary grant schemes. That meant we could support over 8,000 Wiltshire businesses. And our officers responded to inquiries from an additional 3,200 businesses. They sent over 10,000 emails. And one of the nice things that came back, we got more than 1,200 thank you notes from businesses who received help. And that help, when our staff was working at weekends and over the Easter period, to get a thank you note really does a power of good in terms of allowing you to do longer hours and sort out the business support. We ran a 13-week campaign with NewsQuest as part of the reopening of High Street Safely Fund, and this targeted both local residents and businesses in terms of explaining how shops could reopen and continue to operate safely in line with government guidance. And that included things like giving up some pavement spaces or creating some pavement spaces on the street so that cafes and restaurants could spill out onto the previous pavement, so to allow them to have social distancing and open. We're now looking into other campaigns that could support shops and businesses during the national restrictions and in the lead up to Christmas. And in Cabinet this morning, I said that one of the things people might do is turn to shopping online rather than going out to shop, which I entirely understand. But I would stress that you can still shop locally online. So you may well need to shop online, but shop locally online. See if the place you would have gone to has got an online land site that you can either order from, have delivered, or click and collect from them, because that will then support the local business. We're still waiting for government guidance in terms of the new support schemes. We know roughly the support schemes, which depending on your rateable value, will either give you about £1,300 a month, £2,000 for the month, or for the bigger rateable values, £3,000 for the month. And this is for businesses required to close due to local or national restrictions. Will also be eligible for the following aspects. So the £1,300 is for rateable values of up to £15,000. We had a question this morning at Cabinet, which was quite an interesting question, talking about zero-rated businesses, and we're finding out the answer to that. So we will publish that on our website. For properties between £15,000 and £51,000 rateable value, they'll be getting £2,000 a month. For properties with a rateable value above £51,000, they will be getting £3,000 a month. And that is a change from last time, because the limit last time in terms of business clients limited support and didn't allow support for companies with more than £51,000 rateable value. And I know that affected quite a few of the entertainment industry, and so that there's more support for them this time. We know that not all businesses pay business rates. So the government is also giving 1.1 billion to local authorities, not each local authorities, across all local authorities, for one-off payments. So again, we'll be setting up schemes in terms of supporting those businesses that do not pay business rates, either working from home or individual people who work and cannot trade at the moment. Alongside this, and this happened last time, we had superb support from all of our partners in this, and that's such as Citizens Advice, the Swindon and Wiltshire Local Enterprise Partnership, who set up their growth hub, and we helped support that growth hub to help businesses who were desperate for support and help, so we could signpost and direct businesses to help that was more specific to them, and as well as the local chambers of commerce and other organisations, and we will be doing that again. So my plea would be to all businesses, if you struggle and if you really are getting very worried about this, speak to someone about it. Either ring us or we'll put you in touch with the Growth Hub. The people in the Growth Hub run businesses, support businesses. They may well be able to help you in a way that you hadn't thought of. So please contact them. Don't stay silent about it. We are also able to offer support in getting in touch with other schemes such as the Coronavirus Job Retention Scheme, Self-Employment Income Support Scheme, the Kickstart Scheme, the VAT Deferral Scheme, Corona Business Interruption Loan and Bounce Back Loans. So please get hold of us, talk to some of our partners and get help for yourself if you need it. Thank you.
Thanks very much, Philip. Terence, this next question is for you, and is how will schools and early year settings operate during new national restrictions? And what is the approach to home learning for pupils who are asked to self-isolate?
Okay, thanks, Will. Our schools and early year settings, nurseries, childminders, preschools, I think have done a fantastic job since the start of lockdown back in March, whenever it was key workers and vulnerable children who they were open for. They provided ongoing support all the way through the Easter holidays, whenever schools would normally be on a break. And through the developments of the last few months, they've been there for their pupils. I can't underestimate the amount of guidance that has come out from central government, the DFE in particular, that schools have had to adapt and change. Has been significant, and they've done a truly amazing job. And we in the council have been there every step of the way to support them with our education department and our public health teams, and we continue to provide that support and advice, and we will do that through this second period of lockdown, which is, as we've all said a number of times before, different to the first one. And that's because the educational settings are all staying open, and they'll continue to operate as they have for the first half of the new school year. Families will know the settings have got clear preventative strategies and COVID-19 plans in place since September to minimise any risks. Significant risk assessments have been undertaken about their COVID state and compliance, and any risk to pupils and staff has been significantly minimised so that they can continue to get that all-important education in their settings. Now, there have been schools in the last few weeks that have had to self-isolate pupils, and this can be just a few pupils to a whole class or year for secondary schools. And these self-isolation measures with support from our public health teams have been important to minimise any risk of transmission in schools. I'm a father of a 16-year-old boy and a 14-year-old girl, and they've both been subject to bubble lockdowns where they've had to come home for a 2-week period. And we've been asked questions about why schools have done this, and it's so that they can ensure as many pupils as possible can maintain their education and avoiding as much disruption. So they group them into these bubbles, and it is really noteworthy that the vast majority of cases in schools have been as a result of community transmission outside the school and not in the school setting at all. We're not seeing transmission within schools, but of course, as you'd expect, we'll continue to monitor the situation and support the schools. All schools have provided home learning for those students self-isolating as soon as they're off school, so no pupil needs to miss their learning, and this will continue to be the case for the future, and I imagine it will be well into probably for the rest of this school year. So we understand that there may be some parents who have concerns about sending their children to school, to the earlier setting or to college, and we would ask you to talk to the school, and they will advise you on the preventative measures that they have in place. Schools have been back since the start of September, and that means if you keep your child away from school other than because they're unwell or have an unavoidable appointment, then their education is really going to be harmed, and it'll be an unauthorized absence. And I can't stress enough, as I'm sure parents will know, the emotional well-being of your child will be significantly impacted if they're missing education and spending time socializing with their friends and their peer groups. So the key role that they have can't be underestimated, and our schools in early year settings are COVID secure. With preventative measures in place, they're well placed to welcome children. They can continue their learning in the classroom environment where they can learn from staff, teachers and each other. So I'd say that our schools are safe, that the support that they're getting from us as a council and from Kate's public health team is significant, so you should feel confident about your children going back to school.
Thanks, Terence. The next set of questions we've combined, and predictably there are a lot of questions about test and trace for you, Kate. So are we doing local test and trace? Is testing working and our results coming back quickly enough? And where are our local test and trace centres, and what is the council doing to ensure there are enough slots at these local testing centres?
Thanks, Will. So I'll take them one by one. So in terms of are we doing local test and trace, I think it's important to remember that NHS test and trace is the national system. However, we are developing our local testing partnership in Wiltshire, which is being set up so that we can follow up all COVID cases who national test and trace have been unable to reach. So that will be the team will try and contact people through text and phone calls, completing the test and trace data capture process locally, so that we can provide advice around self-isolation, identification of close contacts, but also so that we can be then providing support for our residents who may need to self-isolate and may need some additional support from us as a council. And then all of that information that we gather will be directly fed back into the national test and trace system. So we're integrating the national and local data into one place, but we're very, very keen to make sure that we're taking a local approach to this, so we're supporting our residents appropriately. In terms of the next point around testing working and results coming back quickly enough, again, I think there's been a lot of media coverage as to the national testing system. There was lab capacity issues, which we know were causing problems for people all around the country. Test result turnaround times currently are between about 24 to 72 hours. And that's improving every week. So that is an improved position to where we were a few weeks ago, and we've not heard too much adverse feedback on this at all. So an improving picture. Obviously there will be some test results that fall outside of these times, but overall the time it's taking for them to be returned is reducing, which is really good. It's very positive in terms of then what we can do locally to be minimising any onward transmission from positive cases. But again, it's a nationally run system at the moment, so it's one that we have to just rely upon. And then in terms of where are our local test and trace centres and what is the council doing to ensure there are enough slots at local testing centres? Again, the testing sites are a nationally run programme. However, within for the county of Wiltshire, we currently have 2 regional testing sites that our residents can access. That's one at Salisbury Park and Ride and one at Wroughton Park and Ride for those in the north of our county. We've also got mobile testing units currently situated in Trowbridge, at the Greyhound, and in Warminster at the depot. And in addition to that, we're also in the process of developing semi-permanent testing facilities. The first would be run out of the Greyhound site in Trowbridge, and these are called local testing sites. And these give us a much longer term offer around testing for our residents. There's greater security that our residents can access tests. And those local testing sites are not subject to redeployment, which the mobile testing units can be. However, I would stress in the event that we required additional testing capacity due to an outbreak or due to rising cases in our community areas, if we had hotspots, we can seek to request additional resource and have mobile testing units deployed from other areas in the region. And we would discuss that through our testing cell that we have across both Swindon and Wiltshire, and they oversee that responsibility for us.
Thank you, Kate. Next question, Cyril, for you. So, what is the latest guidance for those people who are in bubbles, shielding or in isolation? And also, specific issue, can I visit members of my support bubble or provide care for vulnerable people?
Super, thanks, Will. So in terms of support bubbles, it is best to limit all your social interactions at this time to help stop the spread of the coronavirus. We've talked about this a lot. This virus likes people, so the fewer people you're with, the less risk there is of you becoming a positive case and then of passing it to somebody else. However, if you do want to expand the group of people that you can have close contact with during the pandemic, making a support bubble with another household is deemed to be the safest way to do that. So a support bubble is a close support network between a household that has only one adult in the home. So that's a single adult household and one other household of any size. So households in that support bubble can still visit each other, they can still stay overnight, and they can visit outdoor public places together. In terms of protecting people more at risk from coronavirus, so in terms of shielding, if you're over 60 or you're clinically vulnerable, so that means over 70 regardless of medical conditions or under 70 with an underlying condition, then you could be at higher risk of severe illness from coronavirus. We've seen that this year. So you need to be especially careful to follow the rules and minimise your contacts with others. Again, it's about not letting that virus have an opportunity to come to you. Very much continuing to wash your hands carefully and more frequently than usual to make sure that you don't risk having that virus on your hands and then letting it enter your body. And maintain thorough cleaning of frequently touched areas in your home. So clinically vulnerable people are asked to be especially careful, but they don't have to shield. Those people who are defined as clinically extremely vulnerable to coronavirus, so that's people with specific serious health conditions, are being advised to work from home. And if you cannot work from home, you are advised not to go to work, and you may be eligible for statutory sick pay or for employment support allowance. Now, people in this group are encouraged to stay at home as much as possible, but are also encouraged to go outside for exercise. It's really important that we maintain our overall fitness, and it's important to find some joy in every day. So being outside for some exercise. New guidance will be published shortly, and the government will be writing to everybody this week who is clinically extremely vulnerable to set out the detailed advice whilst the new restrictions are in place until the 2nd of December. In terms of isolating or isolation, if you have COVID-19 symptoms or you've received a positive test result, you must stay at home and begin to self-isolate for 10 days from when your symptoms start. You should arrange to have a test for COVID-19 if you've not already had one, and the result of the test will determine how long you must stay at home and self-isolate. And if you've been identified as a close contact or someone testing positive from somebody testing positive for COVID-19, you must isolate for the full 14-day period as instructed. Now that's longer than if you've tested positive because it takes 14 days for the virus to incubate and to show itself. So it's really important. And then the last point on this slide, can I visit members of my support bubble or provide care for vulnerable people? Yes, absolutely, you can visit members of your support bubble. And again, as we mentioned before, the support bubble is where that's a household with one adult and it joins with another household. And as we said before, households in that support bubble are still allowed to visit each other, stay overnight and visit outdoor public places together. From Thursday, the 5th of November, you can leave or be outside your home for specific purposes, which includes providing care for vulnerable people. And again, we are expecting further clarification on what people can and can't do under new government guidance, which is due to be published shortly. And as soon as we get that, we will, of course, be making sure that's available and clearly communicated to you.
Thanks, Kate. Final question for you now. How do we as a community keep COVID-19 transmission low in Wiltshire?
Yeah, so this is very much about cutting the chain of transmission, not allowing that virus an opportunity to get to us. So with cases on the rise nationally and locally, we do need your help to keep the virus under control. It's really, really important that all of us keep playing our part, doing those simple things, and they really make such a big difference. So staying at home, you must not leave or be outside of your home except for specific purposes. And I'm going to read a list of these now. So that is for childcare or for education, for work purposes where your place of work remains open and where you cannot work from home. So that includes if your job involves working in other people's homes. To exercise outdoors or to visit an outdoor public place, you can do that with the people you live with your support bubble, or when you are on your own with one person from another household. Now, children under school age, as well as those dependent on round-the-clock care, such as those with severe disabilities, who are with their parents, will not count towards that limit on 2 people meeting outside. For any medical concerns, reasons, appointments and emergencies, or to avoid or escape risk or injury of harm, such as domestic abuse. For shopping for basic necessities, for example, food and medicine, which should be as infrequent as possible, really minimise the number of times you need to do that if possible. And to visit members of your support bubble or to provide care for vulnerable people or as a volunteer. We should really be minimising time spent outside your home, and when around other people, ensure that you are 2 metres apart from anyone not in your household or support bubble. And remember, it's the hands, face, space. So really washing hands regularly for at least 20 seconds with soap. Wearing face coverings in enclosed spaces and public areas unless you are exempt from that. And making space. Stay at least 2 metres apart or 1 metre with a face covering or other mitigating precautions. And being really conscious of those main symptoms of coronavirus again: high temperature, new or continuous cough, and a loss or change to your sense of smell or taste. Most people with coronavirus have at least one of these symptoms, and so if you have those symptoms, get a test, and if you test positive or are contacted by Test and Trace and advised to self-isolate, then you really must do this. And when we put all of those precautionary measures together, it really does build quite a protective wall around us and our communities for stopping the transmission of this virus.
Thank you, Kate. And the last question is for Terence. How do we report people that don't adhere to COVID-19 regulations, and how is the council approaching enforcement?
Okay, thanks, Will. If people wish to report anyone for not adhering to the regulations, then that's a matter for Wiltshire Police. However, I'm very pleased to say that for the most part, everyone in Wiltshire seems to be adhering to the guidance. So far in Wiltshire, we've had very few people who aren't, and we're sure that that's going to continue over this next 4 weeks during the new restrictions. I think some of the issues were around the early closure of pubs, and that brought a few challenges. There is obviously a minority who are deliberately not following the rules, though, and are putting other members of our community at genuine risk. It's important to understand that the virus is real, and that those who are engaged in discussions around conspiracies, etc., are just wrong, and you need to listen to experts, scientists like Kate, whenever they explain the damage that the virus can do. We're not an urban area, we're not a metropolitan area, we don't have some of the problems that other local areas are facing. So I think that in part is a significant reason for why our infection rates are where they are. Our public protection team have been working with businesses and other stakeholders. That's going to continue. This ensures that everybody is familiar with the guidance and the responsibility. Enforcement is obviously a last resort, but of course it will be used if necessary. There have been a lot of restrictions and rules that have been implemented over a pretty short period of time. So there is a need for us to give people the opportunity to get used to them and for them to be fully embedded. And as much as these restrictions, guidance and advice are put into bite-sized pieces of information and simplified, then we think that the restrictions and the guidance will be followed more easily. We've worked with different businesses to ensure that they regularly inform their own staff about the responsibilities outside the workplace. And as a council, we've done that with our own staff, as any responsible employer should do. And that's obviously another way to reiterate key messages. So if you're an employer or an employee, try and work from home as much as possible. Follow the rules and the guidance, the advice that Kate has pointed out on a number of occasions through this webinar. We are taking the approach where we will educate and inform and advise our residents, our businesses and our communities, and we think that's probably the best way rather than an enforcement type approach. And I think that the most part, the residents of Wiltshire are smart, intelligent people. They'll follow the guidance. Philip, is there anything that you want to add to that?
Yes, I will just add that one of the reinforcements for our attitude in terms of education and support rather than enforcement is that we especially towards the beginning, some time ago when pubs first started to reopen, we went to a couple of pubs following reports and suggested that they weren't really doing their social distancing as well as they could do. Every time we did this, we got a superb response from the owner or the landlord or whatever in terms of making things work better, putting it right. They were concerned that they hadn't been good enough, and that sort of attitude throughout. And I think that's really refreshing. So all they wanted was a safe environment for their customers. And they went over the top in terms of trying to sort things out. So that's why we see it very much as an education, support, advice network. And I've got the NHS app myself, and I went to a restaurant just the other week, and they had the QR code on the outside. I went in there, but they didn't actually ask me if I'd scanned to come in, and I thought they should have done. I thought they should have checked that I'd scanned myself as I came in, or if I had to scan myself, they should have asked me some details, so that if we do have to chase people up, if we do have to track and trace, we can do that more easily. All right, so I raised that with them, and they said they made sure the staff would do that in the future and everything else. So everywhere we've had a perceived problem, when we mentioned it, it's been resolved in terms of taking it forward to a much better level. And I think that's much better than doing what could be seen as enforcement as such. I don't want to do that. I'd rather have people working together and achieving things. I think that's everything from us in terms of today. We had lots of questions in. We in terms of time and everything else, we did try to combine some. So my sincere apologies if we didn't quite hit the question that you'd raised with us, and if you drop us a line, then we'll be more than happy to pick it up directly and answer that. And we've had other questions that have come in whilst we've been doing this that we will respond to, and everything else. We're quite happy to do this again if you thought it was helpful, and if you think it's worthwhile to do this again, and we'll be happy to receive feedback from you that. If we all follow the restrictions, then we will curb the spread. As I've said many times, coronavirus doesn't spread itself. All right, it needs people to help it. It enlists its support, and we are its support in terms of spreading it. So likewise, we are the ones that can stop it spreading, and that's in our hands. And speaking of hands, make sure you wash them, okay, and do it for 20 seconds and regularly, and keep your space. Keep your distance from people, okay, and make sure you look after yourself and keep yourself very, very safe throughout all of this period, and help others be safe as well. And I think that's key to it. We all support and help each other. And I'll hand over to Will, who's got some further information about how you can view a video of this webinar. Keep updated on the latest advice, and I stress that because we will email information out to people on a regular basis. Just sign up for it. Even I've signed up for it, and I still get emails, and every so often I get an email that I didn't actually realise we'd done this or done that. So please do. Will, over to you.
Thanks very much, Philip. So just to say thank you for joining us today. A recording will be made available on the Council's YouTube channel, and you can find that by going to YouTube/Wiltshire Council is our channel. We will post the answers to the questions that were given tonight on our website. And our website is www.wiltshire.gov.uk. You can give feedback about this session and any suggestions for future sessions via our Facebook page, or email communications@wiltshire.gov.uk. You can also follow us on Facebook and on Twitter. And also, if you go to our website, you can sign up to our weekly e-newsletter. So thanks again and have a pleasant evening.